Hi, my name is Catherine Rowe, and I would like to briefly discuss some different components of my grant proposal. First is my needs statement, um, and that includes that this particular population experiences different levels of care while they're in treatment, with decreasing structure but increasing life stressors. Um, so, with the decreasing level of care, clients typically see increased mental health symptoms, which coincide with a poor treatment prognosis, and just a general decline in ability to perform daily living skills. So perceived stressors are, of course, your job search, job loss, financial insecurity. These individuals have fines. Often they have a referral source, such as probation or some other legal consequences, where they have to pay fines and they are at this point unemployed. And when we talk about needs for this population, we've all seen the effects of the opioid crisis and heard about increased death associated with fentanyl and other substances. So, for innovation and evidence, I have our supported employment program, along with mental health support. And supported employment and mental health therapy, they're both well defined and well researched models. And supported employment, with the additional resources that the agency provides, um, will provide clients with a more holistic and comprehensive approach to treatment, thus improving treatment outcomes and success. So, activities will include our agency. We will provide training to staff, training to clients as needed for employment. We will have community outreach events. We will foster conversations with local employers, provide education, develop relationships. Um, and of course, we will provide AOD education, AOD counseling, mental health services, and case management services. Now, the timeline and the plan of evaluation include a phase system where phase one is your first 6 weeks of transitional treatment with supported employment. So this will be roughly 6 weeks, as there are individualized needs that need to be accounted for. But for 6 weeks is your job search. There will be financial counseling, vocational counselors, help individuals formulate and submit resumes, applications, job searches. Phase two, roughly 12 weeks of treatment. The mental health and AOD services continue. But at this point, the client should have a job before they phase up, and then transportation will be provided during this phase while clients seek independent measures of transportation. So in phase two, they will also focus more on budgeting and finance as they prepare for the third phase of treatment, which is where they will develop an exit plan, and also have a savings and a budget ready that coincides with their exit plan. So as far as evaluation, every 30 days, there's a treatment plan. Goals and objectives will be included, and then attained um, in individual services, whether it be mental health, case management, or AOD. Um, so we will work towards trying to follow this timeline with clients in order to facilitate independent living ultimately, as well as means for transportation. Um, so that's it. Thank you for listening, and excuse my very brief overview, but I'm excited for you to review my full grant proposal. Thank you.